Hello, my name is Marc Hoffmann. I'm the director of the lymphoma department at the University of Kansas. It's my pleasure to be here today to present some of the data that we just presented here at ASH 2025. So the first abstract that I'll be talking about is a new drug called Sonrotoclax. Some patients may be familiar with a drug called venetoclax. It's a drug that's called a BCL2 inhibitor. And these drugs were developed to allow cancer cells to die. So they basically allow the cancer cells to undergo their natural death process that has been interrupted by some of the signaling that goes on within the cells. There were multiple different cohorts on this study, meaning there's several different ways in which the Sonrotoclax was combined in patients that had never before received therapy for CLL. And the abstract I presented was with a partner drug called obinutuzumab. And some of you may be familiar with that drug. It is a monoclonal antibody drug that's directed against CD20, and it combines well with venetoclax, and we have long-term data from a study called CLL14, which showed that giving a 1-year course with 6 months of IV therapy and 1 year of oral therapy resulted in long and durable remissions in a lot of patients with therapy-naive CLL. So that was the backdrop for this study. Sonrotoclax is a slightly different compound compared to venetoclax. It is a bit more potent, it has a shorter half-life, and it is anticipated that it may both work better and have fewer toxicities. That's not known at this point, but this was the first step towards recording that. And what the study found was that the response rates were extraordinarily high. There are 25 patients in the cohort. A couple of them had an unfortunate circumstance where they developed something called Richter transformation. Other than that, those Richter transformations, everybody responded to treatment, and importantly, they were able to get to a very, very deep remission. So there's a concept called MRD, or minimal residual disease, and these patients, of all of the patients who were response evaluable and completed therapy, meaning taking out the 2 patients that had Richter syndrome, all of those patients achieved undetectable MRD where they had less than 1 in 10,000 cancer cells that were detectable. With the MRD technique, they were actually able to find that the majority were actually less than 1 in a million cancer cells. So it's very exciting data. It's preliminary. It's obviously in a smaller group of patients, but it's quite encouraging, and we look forward to having it in additional what are called phase 3 studies, where that particular combination will go up against additional standard of care treatments and see which one is better.
If our videos have helped you in any way, and you're able to, please consider making a donation to help us continue this important work.
Your gift will go 3 times as far when we reach $500,000 by the end of the year.
Every contribution, big or small, makes a difference, and we're deeply grateful for your support.